within about a week, 2 weeks or so, I was beginning to have heart symptoms or whatever. I was really concerned. I said, oh, no, oh my gosh, am I going to have to go back to the States, bring my whole family back over there? And then I was digging into a bit, and the professor I was working for, Mary Weiss, who's an American but had lived her professional life in Paris, said that, well, she can't eat in the cafeteria in Pasteur because they use sunflower and safflower seed oil and gives her a stomach ache.
Ooh.
Right.
And those are I believe those are the two highest linoleic
Yes,
acid seed oils.
yes. And I was feeling the same thing. I was like, oh my gosh, I'm on sabbatical. I can go have a regular meal. It's going to be good French cooking. And then I'd have this stomach ache. And then 1 or 2 hours afterwards,
Huh.
it would go away. And so then she told me this. And so I said, well, could that be related to what's going on with my drug, the drug I was taking? Because I knew that the drug I'm taking is being metabolized by cytochrome P450 enzymes. And it just so happened that guy that had cloned that cytochrome P4 enzyme was actually a postdoc in the lab. Right? And so there wasn't anything in the literature at the time that I knew about that linoleic acid was increasing the expression of that particular cytochrome P450 enzyme, but I put the two together. Cytochrome P450 enzymes are highly regulated by what you eat,
Right.
as well as drugs that you take. My diet is now changed. And so I emailed all this to UCLA, my nurse and my doctor. Then they said, well, just take more of the heart meds. And I go, okay. And then I was fine. Right.
Wow.
So, and thinking about that, when you travel to a different country, first you have the whole circadian rhythm changes. And
Right. Right.
you're eating different food, which is great and wonderful. That's why you go traveling. But even the basic thing, I mean, so even like potato chips in France.
Right. They're different. That can literally, the things you're eating, the potato chips you're eating could literally alter how your liver is metabolizing a heart drug.
Yeah.
Yeah. And that's, I mean, it's kind of fortuitous. The last episode I recorded was all about how the MUFA-PUFA ratio actually regulates circadian rhythms. And so all of these things tied together in a really fascinating way.
Yeah.
Wow. So well, let's talk about this first. You've got some other results that I believe are not fully published yet about vitamin B1 and the relationship that has to soybean oil / linoleic acid and fatty liver and obesity. And it looked like the results were pretty remarkable. This might also tie into sort of what we mentioned earlier around how, what you eat is going to affect things like gut inflammation, gut permeability. And it is possible, in fact, this happens all the time, to be obese and in a state of what they call calorie surplus and putting on fat, but at the same time malnourished with respect to other nutrients. And a lot of that can start to make sense when you think about things that are affecting nutrient permeability in the gut. So what are these vitamin B1 results that you guys have got, and how do they tie into this picture?
Yeah, this is interesting. A guy named Michael Kenmar, I think that's how you pronounce his name, reached out to us, just sent us an email out of the blue about our linoleic acid soybean oil experiments. And he had the hypothesis that soybean oil was somehow impacting vitamin B1 metabolism. He's not a scientist. He was an investor of sorts, and he started up the Thiamine Advocacy Foundation. So he was a big proponent of vitamin B1. And I didn't know really that much about vitamin B1. It's not like vitamin A and vitamin D, which are hydrophobic and ligands for nuclear receptors. Vitamin B1 is water soluble, so a completely different thing. They just share the name vitamin. But one of my colleagues 2 doors down here, Patrick Degnan, studies vitamin B metabolism in bacteria.